Welcome back to Eye on the Desert for a story on how sports medicine can help golfers to stay on course. Pain from arthritis, back problems, or surgical procedures has forced many golfers to give up the game that they love, but some local doctors and a certified trainer and golf professional say that does not have to happen. Sometimes golf hurts, but it doesn't have to. LPGA teaching professional and certified athletic trainer Patty Curtiss brings her passion for sports medicine and golf together in a unique routine that helps golfers recovering from injuries, surgeries, and chronic problems to hold on to their passion without the pain.
Many people say, I was told to give up the game by a doctor or my husband or whatever it is, and within about 15 minutes I will basically convince them that they don't have to.
Curtiss helps golfers work within their physical limitations to build a more efficient foundation that is repeatable and consistent and does not hurt. Her program is medically directed by doctors like Stephen R. Steele, who has referred many golfers recovering from injuries and surgeries to Curtiss.
I trust her with my patients because she knows the injury side of things and the rehab side of things as well as the golf swing, and she's able to incorporate those pieces of knowledge into one issue of having a patient be able to return or stay in the golf world and continue to play safely.
Larry Pittman is an avid golfer who has had 5 orthopedic surgeries to his back, neck, and shoulder, causing him to consider giving up the game. The single-digit handicapper was referred to Curtiss, and today he plays pain-free.
I wanted to make sure when I came back to the game that I wasn't making bad swings and hurting myself. So we came with her, and she's done a great job with me. She's got a lot of, so far, we've got me back on swing playing and not hurting myself while I'm doing it.
Curtiss uses common physical rehabilitation tools like medicine balls, tension bands, and foam rollers to increase strength, flexibility, and balance. And she has a new gadget called the K-Vest that measures golfers' swings against the baseline of a PGA or LPGA Tour player.
You know right away, where am I with my posture? Where am I with my hip rotation, my torso rotation, compared to the PGA or LPGA norms? It's a baseline. We're not trying to make people tour players at all.
She is trying to help people heal through golf, which is what often happens after people leave medically mandated physical therapy and begin physical therapy related directly to their golf game.
The rehab's done and the rehab person says they're okay, but then they still hurt when they golf. So this kind of program kind of cuts the gap or bridges the gap for what we call post-rehab, kind of game-specific or sport-specific rehabilitation now, after the therapist is done.
People should feel safe knowing that there's golf instruction that's not going to hurt them, and at the same time help their performance in ways unlike we've been able to do before.